Good morning, everybody. My name is Sarah McPherson, and I am the Research Programs Training Manager in the Division of Research and a member of the Love Data Week Planning Committee. I want to welcome you to Brown's sixth annual Love Data Week, which is co-sponsored by the Division of Research and the University Library. For those of you who are unfamiliar with Love Data Week, it's an international celebration of data aiming to raise awareness and build a community to engage on topics related to research data management, sharing, preservation, reuse, and research data services across disciplines. This year's Love Data Week theme is Whose Data Is It Anyways, with over 15 events planned throughout the week. We invite you to check out the Love Data Week's full list of hybrid and online only events by clicking on the link that we'll soon include in the chat. I would now like to welcome you to one of Love Data Week's talks by a panel of presenters who will be discussing the URSA Initiative, Navigating EHR Data Sharing and Access in Rhode Island. Each speaker will introduce themselves during the presentation. Please join me in welcoming the panel.
Good morning, everyone. Thanks for joining us today. So we look forward to talking more about navigating EHR data sharing and access in Rhode Island. Here's our plan for today. The outline on the left, we'll be going over many different topics. And our panelists are on the right. Each of us, as was mentioned, will introduce themselves as we get to their parts. And so each of us has about 5 minutes to talk about what we do and how we might be helpful to you. A lot to cover, but just thought we'd use this opportunity during Love Data Week to provide some highlights. So I'm Liz Chen. I'm a faculty member in the Division of Biology and Medicine. I also head up the Center for Biomedical Informatics, as well as the Informatics Core for the Advance-CTR program. So a lot of what we do is related to working with electronic health record data. And so the graphic on the left shows as clinicians are taking care of their patients, a lot of that information about that visit is getting recorded within electronic health record systems. These are things like patient demographics, conditions or diseases that a patient may have, their medications. And so all this data getting collected in these EHR systems, getting housed into a database for that EHR system can be used for secondary uses like biomedical research. They can be used to populate registries, regional, local, national registries. And then what we can do is we can learn from that data. So we can use statistical techniques. We can use AI techniques like machine learning and natural language processing to turn that data into knowledge, which may provide new things about standards for prevention and treatment. And then what we can do is try to put that knowledge into practice. This could be new guidelines, new educational materials. I'm thinking about tools like clinical decision support within EHR systems and turning that knowledge into practice, putting it back into EHR and kind of going through that cycle again of learning. And this we will is referred to as the learning health system. So in thinking about doing research with EHR data, we need to really use the same level of academic rigor when analyzing research from clinical databases that might house EHR data. We should think about observational research as a team science. So it's not just one group of individuals, it's folks with different backgrounds and areas of expertise, clinicians, informaticians, biostatisticians, computer scientists, data scientists, and others. And one of the things to think about that we may not always realize when we get EHR data is, what's the governance? What are the policies and procedures behind obtaining and sharing data across institutions? What's the technology needed to do this sharing? And what's the collaboration that needs to be done between institutions and their research governing teams? So we've been working on this for quite some time within Rhode Island and across Brown through what we call the URSA Initiative, the Unified Research Data Sharing and Access Initiative. And this is an effort that really thinks about how do we do cross-institutional data governance? What's the cyber infrastructure needed to support data sharing? And what training is needed for researchers for secure access and use of EHR and other health data for research purposes across Rhode Island? We've been working on this for almost 10 years now, initiated by the Brown Center for Biomedical Informatics and then operationalized through the BIBSI core of the Advance-CTR program that's really focused on providing resources, services, and training for the clinical and translational research community in Rhode Island. And it's not just us, it's really a close partnership with many groups across Brown that you'll be hearing from today. as well as the analogous groups with our health data partners. So those providing data. And so some of the places are highlighted on the right. So some local EHR data providers, like our healthcare systems, hospitals and clinics that are affiliated with Brown. Mimic is an example of EHR data from Beth Israel Deaconess up in Boston. And there are also national EHR data that's become available, particularly in recent years. One called N3C and the other one, the All of Us Researcher Workbench. And so what's core to this, as was mentioned, is data governance. And when we think about that, there are kind of four essential pillars when we think about a health research data governance framework, thinking about things like we want to make sure we're getting quality data. Is it accurate? Is it complete? Thinking about things like stewardship, who is responsible and accountable for that data, making sure we protect the data, making sure we're compliant with regulations, and then thinking about data management best practices. How do we store data? How do we retain it? How do we integrate it, and thinking about that whole life cycle management of data. And what's shown on the right is within the data governance framework, there are these four pillars, but what really makes it work is this balance between the people, the process, and the technology. And that's what you'll be hearing a little bit about from each of our groups today. So just kind of to lay out a high level process, as you're thinking about doing a research project starting from the left and going all the way to data analysis, you really want to do some interesting analyses to turn that data into knowledge. But what are all the steps in between? And that's really what we're trying to get at today at a high level. So I'll kind of walk through this and who you would talk with for each of some of these steps here. So first, really engaging with the regulatory advising unit within Brown's Division of Research to think about, all the steps throughout the process. As you kind of get to, thinking about human subjects protections, IRB protocols, engaging with the Human Research Protection Program at Brown. Some of the projects or some of the data may require a data use agreement or DUA or data transfer and use agreement. So working with our research agreements and contracting. And then also then thinking about how do we transfer our data securely? Where do we store it? And working with our Office of Information Technology and groups, including the Center for Computation and Visualization. And then finally, thinking about data management more broadly and also thinking about adhering to federal requirements. So NIH, NSF for data sharing, working with our library, in particular within our data management services. And so what we'll here is now go through each of these 5 groups and hear more about what they do and who they are. So I'll hand it over to Dr. Levy to talk about the Regulatory Advising Unit.
Hi, thank you, Liz. Thank you, Liz. Hi, my name is Jimena Live. I'm the director of the Regulatory Advisory Unit at Brown. The mission of this new unit is to provide guidance and support to researchers engaged in human subjects research and data research. And we're trying to cover the whole full cycle of the project from the beginning, from the time that the researcher is having a research idea, helping them to assess the feasibility of their project, the feasibility of the data they want to retrieve, and to the end of the project, how they have to dispose the data, and what is the plan for documentation and destruction of the documentation of the project from the regulatory perspective. So this figure that you see here is a high-level overview of the regulatory framework affecting data using electronic medical records. This figure presents some of the regulatory areas that can affect projects when we're using EHR as the source of our data for research. The blue circles that you are seeing here, those are federal mandates that are highlighted, and they are triggered as soon as we want to start doing research with medical records. Some of those, not all of them, but some of these, at least HIPAA, those are triggered right away. And that is on the HIPAA covered entity to make sure that we are compliant with the mandates of these federal regulations. I'm not going to go over each one of them, but I just wanted to put it there for us to visualize what's the framework, the regulatory framework that governs this data project. So, and also to understand what is the complexity of the research projects when we are doing research with healthcare providers and academic institutions, because it adds to the complexity of the already complicated and regulated landscape of research. Most of these requirements are based or are focused on data management plans, focus on data safety monitoring boards that sometimes have different names, and also in making sure that institutions have policies and procedures that guide this process. That's why the URSA initiative is so important, because we are going to have, or we will have, the guidance and the guidelines and the governance for research involving data coming from the EHR. So what do we do in our unit? We provide help identifying the regulatory components of the needs of a project. The earlier we do it, the better outcome that we will have. Feasibility is a very important stage when thinking of a research project, and we help in that process. We also support undergrad research, determination of IRB need, if the project needs IRB or not, or actually maybe helping the researcher to tweak the project in a way that the project becomes non-human subject research and therefore doesn't need IRB review. But that's a determination that needs to be done. And then same thing with machine learning, AI projects, millions of data points required by the researchers to do these projects. But that implies a lot of effort and cost, and working and thinking on the right design of the project and the right variables needed to address the research question. That's a very important element. So a few advice that I can provide today, if I may, I will say, always remember, the PI is the direct responsible for the custodian of the data. Everything that the PI has in place should guide the research team towards compliance, towards answering the real research question. The same principles that apply to research working with humans, when we have the human in front of us, apply to research with data. Same principles: autonomy, respect, fairness. That has to apply. Data has to be treated with the same respect that we treat our individuals and our patients. Alignment of the research question with the research variables and the study design. That's a very important element. When you are thinking on the study, think of what is the research question that you want to answer, or research questions, if you may, but define the variables. Having clear definition of the variables that you need for the project, that will facilitate the whole process and will make the regulatory part of the project more simple. I will say we're here to help, we're here to support you in any of your efforts. So I will turn the screen to the next panelist who will help you, will give us some tips about the process of management of data in Rhode Island.
Thank you, Jimena. My name is Alexandra Boutros, and I'm the Brown Human Research Protection Program Director. I'm also here with Sheila Vandal, who is currently our IRB Collaborative Manager and our future Assistant Director in our expanded HRPP. We're going to give you a little bit of background on the IRB review process and a little bit of background on the HIPAA regulatory requirements. Sheila, I'll pass it over to you.
Hey, hi everyone, I'm Sheila. I'm part of the Human Research Protection Program, the HRPP. Our office is often used synonymously with the IRB. We are guided by federal regulations and institutional policy to review research projects that obtain information about individuals through intervention or interaction, or through access to their identifiable information or biospecimens. And our task is to protect the participants enrolled in the research from risk of harm, physical and social. And the highest risk research is then elevated to review by the IRB board, which is a committee of experienced researchers, academics, experts, and community advocates. Ali, want to talk about the actual PHI that we're here for?
Yes, please move forward. Thank you. So you heard the HIPAA privacy rule float around a little bit, and I'm here to explain a little bit about that. HIPAA privacy rule is specific to covered entities, another term that we threw around as well. A covered entity is a healthcare plan or a healthcare provider, anyone who's dealing with electronic health information. It is protected by the privacy rule. It's a national standard, so any one of those covered entities have to meet certain requirements, and there are fines that could be implemented if things are not followed according to plan. The HIPAA privacy rule defines how PHI can be used in a clinical world for their main healthcare operations, but also for research purposes. So in many cases, providers may have access to clinical information for clinical purposes. As soon as they step into the research realm, the rules and the regs change a little bit and they're shaped in a different way. HIPAA defines multiple pathways that PHI can be utilized for research. These are 5 that I've highlighted, but there are some additional ones here. One of the first ones is de-identifying the data. Authorization would be actually getting permission from the participant, from the patient to utilize their health information for research. There's also a possibility that waiver of that authorization requirement can be waived by a privacy board, and in many cases, the IRB can act as that privacy board. There's federal criteria that have to be met, satisfied, documented, and even signed to document that those criteria have been satisfactorily met. Then there's the option to use a limited data set. So it is a data set that removes at least 2 of the HIPAA identifiers that have been identified, and it requires a data use agreement, which I know Jen will speak more about in the future here. And then also sometimes we need to work on decedent data. So this is data of individuals who have passed away, and their data is no longer subject to human subject research regulations. However, HIPAA still has some protections in place where investigators do need to make attestations before they can utilize that data. You can proceed to the next slide. I'll expand a little bit further. So here are the 5 pathways that I defined previously as well. For de-identified, once we remove those 18 identifiers, it's no longer considered PHI. It's no longer protected by the privacy rule as long as those 18 identifiers have been removed from the data set. This allows the data to be moved quite freely and used quite freely because it is no longer subject to the privacy rule. With authorization, you obtain permission from the patient and participant to utilize their data and potentially share it with other organizations. This also is a good pathway to be able to move freely because you have permission from the individual whose data it is coming from. The waiver requirement is possible in some situations to be appropriate. It is subject to the minimum necessary. And what that means is that it has to be the minimum amount of identifiers and health information that is needed to actually conduct the research. It does require very specific justifications to utilize that data, that PHI for research purposes, and potentially share it. And there needs to be adequate plans to protect the identifiers and destroy them at the earliest possible time. Limited data set is also subject to the minimum necessary. So this is the same apply where it has to be the minimum needed to be able to conduct the research. Essentially, it allows you to utilize city, state, zip states, and other unique identifiers that don't meet one of the 18 direct identifiers. This requires a data use agreement, which essentially makes the recipient subject to the privacy rule because they are receiving an identifiable data set. And the last one being decedent data, which is not considered human subjects research, but it still requires that the investigator make certain attestations to utilize that data in a research capacity. And then Sheila, please take it home.
Okay, and so when we're looking at a submission, we're reviewing to see how the data is being managed for confidentiality and protection of privacy. We need to know where the data is coming from, exactly which data points are being accessed and retained. We want to know how it's being accessed. Is it through a VPN and fully housed by the data holders? Is there a plan to transfer the data? And if so, by what means? We want to know how the data is being stored. Who will have access to it? Will it be shared internally or externally? And will that data be in an identifiable format? And ultimately, how will the data be de-identified or destroyed? And we're looking at all of these factors because they're not just data points, they are individuals' private health information. We need to mitigate the risks as best as we can to avoid a breach of confidentiality in order to protect the people who have entrusted us with that data. And that is, yeah.
Hi, everyone. I'm Jen Murphy, Director of Research Agreements and Contracting within the Division of Research. With me from my office is Vanessa Sherman. She's a research contract administrator who focuses on data use agreements. So I'm going to give a very high-level overview of DUAs, but I'm hoping there are two key takeaways from the next few minutes: how to spot a DUA or a situation that calls for one, and how to contact my office if you have questions or want to submit a DUA for review. So what is a DUA? It's a binding agreement to share data for research purposes. DUAs are called many things, so please don't get hung up on the title of a document. They're often called DUAs, but they're also called data transfer agreements, data sharing agreements, data access agreements, and sometimes things you'd never expect, like a non-disclosure agreement, collaboration agreement, sometimes just research agreement. The title is wholly unimportant. The purpose is what matters. If the purpose of the agreement is to share and use data for research, then that's a data use agreement. And for our purposes, we're just going to refer to them as DUAs. So DUAs contain a variety of terms around use, storage, and protection of data. They also address the terms around research associated with that data. So intellectual property rights, publication, liability for harm arising from use. These terms can vary widely from DUA to DUA, so we're not going to get into specifics here. But there are two main buckets of DUA. So we have incoming and outgoing. Incoming is when you've identified data outside of the university that you'd like to use in your research here at Brown, and the data owner or provider or custodian requires an agreement to be signed before you can use that data. And then outgoing is when someone outside the university would like to use research data here for purposes of their own research or sometimes for joint research. It's data leaving the university for a research purpose, and generally speaking, Brown protects that data using DUAs. The most important takeaway from this slide is that researchers are not authorized to sign DUAs. Signature authority for all research DUAs is at the institutional level, not at the individual researcher level here at Brown. Please do not sign DUAs. Next slide, please. So my office manages all research data sharing agreements for the university, along with a few other types of agreements which aren't important for this conversation. But management includes review, drafting, negotiation, and signature. There's one exception here that's worth noting. If the agreement for data sharing is actually a purchase of data, that would be a procurement action, and that requires review by strategic procurement and contracts, and that's sometimes in tandem with my office if there's research terms. But buying data for use in research is not generally managed the same way as a data use agreement. Also important to keep in mind, if you're purchasing data does not include when there's a small fee associated with transferring data for research, that might still be a DUA. So I know this all sounds very confusing, but I promise it's not. If you have an agreement to purchase data, you will know. It's very different from a DUA. Your spidey senses will tingle. You will know that there's something different about this, but you can always share it with our office and ask us, is this a purchase or is this a DUA, before you submit it for review. And if you happen to get it wrong, nothing bad's going to happen. My office works with SBC very closely, so we'll talk amongst ourselves and sort out the proper reviewer. But researchers have a very important role in the DUA process. They have to submit the DUA to my office for review, and they also have to read and comply with the terms of the agreement. And this is crucially important. Researchers are the ones actually using and sharing the data. You're the subject matter experts for how you'd like to use and share data. My office is just the expert for the terms that facilitate that. So we're a team here. If our office doesn't know when or how data is going to be shared or used, we can't ensure contractual protections are in place for the data or for the researchers when they're using the data. And then please, another plea to please not sign any DUAs you've been given by third parties, even if they tell you it's okay. Do not listen. Next slide, please. So as you all know by now, I hope the Division of Research is using Huron grants and agreements. That is for all agreements managed by our office, including DUAs. These are quick tips for submitting a request, but don't worry about memorizing them. If you'd like to see the quick tips again, please email dua@brown.edu or Vanessa or me directly, because the first thing that's going to happen is you're going to get an auto reply that has all of these tips in it. We've heard from many people that Huron is easier than expected, with one exception. It's the pesky submit button. After you've answered the questions associated with the submission, you're going to need to hit submit, and the button's a bit hidden. It's on the left-hand side of the menu. It's the top option. It's well camouflaged. Please be sure to find that button and click it, or the request in Huron will not route to us for review. It will stay in pre-submission limbo forever. And finally, any questions that you have, we are always reachable. We're very responsive. Send us an email. It's dua@brown.edu. Thank you. And I think we have Paul staying next.
Thanks, Jen. Hi, everyone. My name is Paul Stay. I'm the Assistant CIO for Research Software Engineering and Data Science. And I'm going to talk a little bit about our research computing infrastructure here at Brown. So the university's primary research computing center is CCV, the Center for Computation and Visualization. So I am within CCV. CCV is a group of about 40 plus data scientists, software engineers, system administrators, research computing consultants, kind of a bunch of technical folks who have varied backgrounds, but are kind of all interested in and support the mission of research computing at Brown. So our website is ccv.brown.edu. You can find us in this lovely building at 180 George Street. We're right next to the Engineering Research Center. And you can contact us by emailing support@ccp.brown.edu. That'll get to all of us directly and also spawn a ticket in sort of our internal ticketing system. You can stop by office hours between 10 and noon, either on site or on Zoom, and you can find the link in our on our main website. Next slide, please, Liz. So I guess I'll talk about one of our most popular services, which is the Oscar supercomputer. Oscar used to be an acronym, but no one remembered what the letters stand for, so now it's just Oscar. Oscar is about 26,000 CPU cores, a little bit more than that, a little bit more than 800 GPUs of various generations, ranging from a bunch of GeForce 3090s all the way to A100s, H100s. We have some Blackwell chips will be on the way soon. It's a nice collection of varied GPUs. We have about 10 petabytes of flash storage. Oscar is also free to use by anyone. We have different account tiers, but we really try and make it a service that is used by anyone and everyone that has research compute needs. Right now, I think we have about 2,000 active users in any given year. Next slide, please, Liz. I'll also talk about Stronghold. So Stronghold is our secure computing enclave, and it is a network of virtual machines that are I like to describe it as semi-air gapped. They are very, very sort of locked down, and that means you can't get to them from the public internet, and you can't reach out from Stronghold to the public internet. And there's very limited sort of ways that you can access it. And this is for the good and the bad. Obviously, it's an environment where we're able to support research on very sensitive data, including PHI, PII, et cetera. We can deploy Stronghold workstations that are either Windows or Linux. And again, this is a system that is very, very tightly controlled. It's for use with the most sensitive data that folks have at Brown, and we have encryption on all the data, and its access is very tightly gated. Next slide, please, Liz. I'll talk briefly about our sort of storage systems that we have. So we have free storage for all PIs up to 1 terabyte, just by virtue of being a PI. PIs also get an additional 10 terabytes per grant. So a PI with, let's say, 3 active grants is entitled to 31 terabytes, one by virtue of being a PI, and then 10 for each of their active grants. This is usually enough to satisfy most folks, but you can also buy into storage at the cost of $100 per terabyte per year. I should also mention that this data is all our systems are replicated for disaster recovery purposes, and we use Globus as our sort of default tool for transferring data. So you can transfer data in a lot of ways between our services, but Globus is kind of the most robust for large transfers, especially. Globus is fast, a parallel FTP service, and it also does some sort of integrity checks on either side. So it does checksums on your data to make sure you've successfully transferred it. Next slide, please, Liz. And I guess the last service I'll describe is our sort of consulting services. So we have a team of data scientists and research software engineers that have all variety of backgrounds, ranging from applied math to we have someone with a PhD in fisheries and wildlife. So it spans the gamut in terms of our content area expertise. We have a high performance computing team. We have a team that specializes in genomics and computational biology. We also have generalized expertise in web development, machine learning, writing scientific software, just general software engineering. The way that we work is, you can obviously drop in and see us at office hours, but our collaborations in this area tend to be more sort of medium and long term, where medium might mean, a few weeks or a few months, and long term might mean, years or decades. Our longest collaborations are on the order of a decade. Next slide, please, Liz. This is our team. So if you have any questions related to research computing, please stop by, send an email to support@ccp.brown.edu, and we'll be happy to help. And I'll send it off to Andrew.
Thanks, Paul. My name's Andrew Creamer. I'm the Open Science Librarian within the Health and Biomedical Library Services within the University Library. And my role is to help folks with data management plans, but also looking towards data sharing. And even though our services are represented sort of at the end of this pipeline, folks might reach out at the proposal stage to get help with writing a data management and sharing plan and looking for infrastructure that the university might provide or that their funder might provide to help them carry out whatever their funder's policy is for disseminating data after a project ends. And so we have a guide, a resource guide on the library website that's accessible through the Research Integrity Office's page on research data management that's managed by Kelsey Lubin and Research Integrity and the Division of Research. And we coordinate some resources that folks might look towards incorporating into their proposals and their projects for disseminating data. Today, I'm focusing specifically on resources we've developed for clinical data sharing. And so if we go to the next slide, we can see that one of our goals was to make sure that we looked for infrastructure that aligns with the Office of Science and Technology policies, recommendations for repositories for disseminating federal research, and in the NIH case, as well as when folks are developing their data management sharing plans, that they incorporate repositories that also meet the standards for their institute, center, or office. And so when we go to the next slide, we were looking at specifically for clinical data that has gone through this pipeline, that there are cases in which data needs to have controlled access. So folks from the outside need to apply for access and that process of the data use agreement or having an IRB protocol approved. And so these are some repositories that we have memberships with, paid memberships, that provide a controlled access option for de-identified clinical data. ICPSR, which is the Inter-University Consortium for Political and Social Research, qualitative data repository housed at Syracuse University, which is focused on textual, video, images, and interviews, focus group data. And then Vivly, which is our newest membership, which is focused on prospective clinical data, specifically clinical trials. So we can go to our next slide. And using these resources require, again, the experts that are on this panel. So, sharing clinical data in an external repository, we want to make sure that we connect with investigators to make sure that that bar for anonymization has been reached, in particular for Vivly, which is a clinical trial data sharing repository for PIs that might not have staff to do the anonymization. There's a fee that can be, that's an allowable cost for anonymization. And I will highlight that after this call, there's a Vivly presentation for Love Data Week following this presentation as well. So that link that Tori had put in for Love Data Week, you can register for that to learn more about that using that repository. And then we have sort of an internal workflow. Jen's office and Vanessa, that we want to make sure that they're aware that this data is going to be shared, and so following their workflow that they've set out. And so this is just before we've even set up an account to go through that data process to make sure that it's gone through that regulatory framework here. And then on the next slide, we also want to make sure that folks are sure to budget for aspects of data sharing. So even though our memberships, for example, with these controlled access repositories might waive data processing charges, there are additional charges that we want to make sure are incorporated into the budget around controlled access or anonymization services or project-specific infrastructure or curatorial procedures that might be associated with that specific project. And then we go to the next slide. We also want to highlight that we have non-controlled options as well. A lot of them, we have the Brown Digital Repository, which is great because it connects with Globus to use some of the resources that CCV makes available. We have a Dataverse instance within Harvard's Dataverse. We have a Zenodo community within the Zenodo repository. We have an Open Science Framework, or OSF, for institutions repository within OSF. And so we have a lot of great partners, open access repositories in the space, and we want to work with communities. If you have a repository that your discipline or domain regularly works with, that we're trying to have spaces or ways that Brown can support those spaces as well. And then in our last slide, we have a form. So folks that have gone through this process, and just for provenance of data that's derived from healthcare data, that we want to make sure that travels along with that data set in our repositories, so that we know that someone's sort of signed off that data is being de-identified. And this is available on the Division of Research page. Research Integrity manages for research data management and sharing. And then I think there's one more slide after this, which is now the requirement that NIH has for RPPRs, so the final project reporting. So when folks are doing annual and in-project reports, they can put in the digital object identifier, or DOI, that says this is where the data that I said in my data management and sharing plan is located in this repository, or accession number that folks can link back to that. And so there's sort of built-in accountability now, so that folks, what they propose in their data management plan is now reported at the end of the project, which is great. And so we're happy to help all the sort of life cycle points here. So I'm going to hand this off to Karen.
Thank you, Andrew. Hi, I'm Karen Crowley. I'm a biomedical informatician and manager of health data science for the Brown Center for Biomedical Informatics and the Advance-CTR BIBC-Core. That's a mouthful. So here we are, close to the end of our presentation, but perhaps some of you are only at the beginning of this road. We know there are many stops, even side trips along this road, but we thought we'd zoom out and highlight some of the major attractions. From data discovery and IRB approvals to extracting and de-identifying your data, getting it where it needs to go, there's a lot of work to do before you can dig into the data, answer your research questions, and share your results. Everyone who presented today, along with their teams, is ready to guide you on this journey. Next slide, please. So in our final few moments, I'd like to remind us that we are all stewards of precious and sensitive data. We must maintain compliance with all legal and regulatory standards and requirements. We must act with the highest of ethics. We must collaborate. Clinicians, biomedical informaticians, epidemiologists, biostatisticians, folks in our regulatory and compliance organizations, implementation scientists, programmers, analysts. I could go on. Practicing team science will ensure that our research is both methodologically sound and clinically meaningful. Practicing open science will also facilitate reproducibility and maximize the credibility of our research findings. Next slide. We as researchers must develop a community mindset, community behaviors, community practices that will prioritize and value data as critical and a sensitive asset. This culture that we develop must drive how we think about data, how we interact with it, and how we apply it in our work. Each of us must increase our abilities to design effective research protocols, manage and analyze data, interpret results, derive insights, and communicate and apply them beneficently. To that end, we are about to spark a data literacy and culture initiative in our research community. We are developing tools, training, and other resources. BCBI and the BIBC-Core, we've launched the Compendium of Data Science, Informatics, Implementation Science, Artificial Intelligence, and Computing, or Kodiak for Health. We invite you to explore this ever-growing resource and let us know what you'd like to see next. Next slide, please. So here we are. On behalf of our researchers, I thank you for your time and attention. It is our pleasure to partner with you in navigating the road to research. A recording and copy of these slides will be made available, and you can find us via the links provided on this page. I will hand things back over to our monitor to manage the Q&A portion of this presentation.
There aren't any questions in the chat just yet, but I think we can give it a sec. And if there's anything, here we go. Oh, an interesting question from one of our panelists, I guess for some other panelists. So we can start here and give everyone else a couple of minutes to add in more questions. So Paul would like to know, are raw reads of human genetic material, for example, DNA, RNA, et cetera, considered identifiable? They don't seem to be explicitly listed in the 18 HIPAA identifiers.
I'm happy to jump in on that one. That is a good question, and one that's circulating a lot in the world right now. It is not specifically defined as one of the HIPAA identifiers. However, most institutions, covered entities, do consider DNA to be considered an identifier, a unique identifier, kind of looped into that other types of unique identifiers that are specific to an individual. So there are some areas of genetic research where potentially it could not be human subjects research, and then there are other areas where maybe are focusing on genome sequencing that would be considered human subjects research because of the studying of the DNA. So it's very situational. I apologize, it's not a black and white answer, but not much is in our world.
Thank you.
Good to know. I'm not seeing anything else in the chat right now. But I thought maybe I would throw this out there for Liz. If you want to just tell us a little bit more about like how this huge partnership, that how many people did we just hear from? How this huge partnership has sort of worked for you and allowed you to be able to like advance research.
Yeah, I can start and maybe let others add on to it, but I think it's been a very fruitful collaboration. I think, all things we're trying to do, it really is a team effort. And as you've heard through everyone's presentations, everyone brings something different to the table. And I think, Karen and my role in is really kind of bringing everyone together and helping researchers get to where they need to get. And so over the years, I've been here at Brown for 10 years, and so much has evolved and changed. A lot of what we had to do there wasn't a lot. Over the years, our computing infrastructure has enhanced. We've had new roles come in that really can actually help build up what we've been trying to do over the years. And I think you've only heard from the folks at Brown, but really at every health data partner that, we showed on one of the early slides, as well as others we've engaged with across the state, they have the analogous individual. So it really is the equivalent, the counterparts at those organizations that we've been working with. And I think the U in U is unified. Our vision had been, let's have one big process that works for everyone. But I think as we've learned, every health data sharing partner or provider has kind of different policies and procedures. They have different culture. And so we've kind of had to work through them to build up some of the processes, the relationships. But I think that's one of the biggest things when we talk about it. It really is about the relationship building, the collaboration, working together, kind of understanding all sides, everyone's perspectives, and working together. So I think this has actually been a great opportunity for us. We've all kind of been working together for many, many years, individually, but this was really our effort to bring everyone together in one panel. And we hope that we'll, do more of these. As Karen mentioned, we do have plans to have that health literacy and culture. We've figured out a lot of the pieces. I think we have the foundation. We are in the midst of formalizing a governance framework, but I think our next step is really training the research community, thinking about all these things that they have to do on the journey, on that road to get from beginning to end, and that we're all people that they'll need to engage with. So I think I have nothing but positive things to say about everyone who's been on the panel. And that really is, I think, has been highlighted. It is a team effort. team science, open science, and it is the PI's responsibility that a lot of us spend time trying to figure out the pieces, but now we can actually, one of our efforts is now to kind of transition into you as the PI. What are you responsible for? You really lead the effort, but we're here to help you along your journey. Anything else to add from the other panelists?
Yeah, I mean, I think that was a great answer, Liz. And I think it really showcases the partnerships across campus. So Julie asked in the chat if she could borrow some of the slides with proper credit for an upcoming webinar in her center. And I believe that the entire recording and slides are being made available. Anything to add from the panelists?
I think, yeah, we are planning to make them available. We know there's a lot of information that may be useful, and that one of our efforts is bringing that information together in one place. Julie, feel free also to reach out to Karen and me. You can reach us at ursa-help@brown.edu. So if you kind of need, I think all of us probably have lots of other slides and other materials. So if you need other things for that presentation, just let us know. And then we'll actually keep everyone in the loop so they know who's using the slides and for what, so for tracking purposes.
Thanks. So I don't see any more questions in the chat. We do have a little bit more time if someone has a question they're thinking about. Well, I don't really want to sit here in awkward silence, but I think that this has been a really informative and useful, overview of all of these various offices. And as Karen had on her last slide, all of the ways to get to all of the panelists and their teams was on there, and you'll have access to that. And I don't know if one of the panelists, if you guys have a wrap up to say at this point.
I think thank you all so much for coming. We're really glad we could pull this group together and present on the things that we're working on together. And there's more to come. We're busy working away at a variety of things just to kind of make things easier for all of you, and also to raise awareness of all the pieces involved. So again, we're just grateful that you attended. Hope this was helpful. And yeah, enjoy. If you're attending the next talk at noon, enjoy. And enjoy, the other Love Data Week events throughout this week.
And on that, Kelsey put the Zoom link for that noon talk right in the chat here. So you can use that just in case we don't get to registration in the next 10 minutes.